Today, we're going to cover a question that I've received very commonly in the last 2 years for reasons that you're probably aware of. And that question is, what can we do to help prevent blood clots? And if you've been following the news, especially the alternative news that is not as censored as the mainstream media, you've probably become aware of the drastic increase of excess deaths across not only our country, but the world since the rollout of new biologic technologies in the last 2 years. And so clotting is a common mechanism behind many of those deaths, the heart attacks and strokes and things of that nature. And so a common question is, are there natural strategies for clot prevention that I can incorporate to give myself or lower my risk, whether or not you've had multiple shots or not? Since cardiovascular disease is the #1 killer, at least in the United States, clots are often a mechanism that is driving that #1 status. And so even if you've never had an mRNA shot, but you have a family history of cardiovascular disease or a personal history of cardiovascular disease, clot prevention and modulating that whole physiologic process is going to be very important for longevity in both lifespan and health span for you. So let's dive into that today. And we've got a brand new or very recent study on the topic from the journal Frontiers in Cardiovascular Medicine here. And this was published in August 2022. And the title is Effective Management of Atherosclerosis Progress and Hyperlipidemia or High Cholesterol Levels with Nattokinase. And you might say, well, what is nattokinase? Nattokinase is a fibrinolytic enzyme. Enzymes are proteins that do work. Fibrinolytic enzymes are proteins that break down fibrin, and fibrin formation is an early step in the formation of clots and coagulated blood. So you might take anticoagulants or blood thinners like warfarin or Coumadin to prevent clotting. Well, if we can, or not to prevent clotting, but to prevent clotting by thinning the blood. But what if we prevented clotting by preventing fibrin formation, preventing the actual formation of the clot? And what if we could do that naturally? That's what many studies have looked at, and this is a recent study showing us not only that nattokinase can be effective, but also lifestyle factors that could augment the effectiveness of nattokinase. And we'll also talk about other fibrinolytics at the end, including lumbrokinase and serrapeptase. So if I forget, somebody ask that at the end, please. So let's jump over to the actual study and get more in detail. So here we are in the study. And again, it's Frontiers in Cardiovascular Medicine, published August 2022. And if we scroll down here, and let's read the abstract first, and then we'll dive into the in-depth stuff. So nattokinase is a potent fibrinolytic and antithrombotic agent. So a thrombus is a clot. So nattokinase, that first sentence says it is potent fibrinolytic. It's potent at breaking down fibrin, which we said is an early stage in clot formation. And it's a potent antithrombotic, it's a potent anti-clot agent. And it's also been shown to have anti-atherosclerotic and lipid-lowering effects. So, by being anti-clot, it's going to also be anti-atherosclerotic because clot formation and then plaque rupture is part of the atherosclerosis process. And atherosclerosis is the hardening of arteries that leads to cardiovascular issues like hypertension, clots, heart attack, stroke, etc. It's also lipid lowering, so it also helps your cholesterol panel. However, data on human clinical studies are limited. This study involved 1,062 participants, about 460-something men and 500 and something women. We'll look at the exact numbers in a little bit. Our objective was to examine the efficacy of nattokinase in atherosclerosis and hyperlipidemia and safety at the dose of 10,800 FU per day after an FU would be fibrinolytic units per day after 12 months of taking it orally. We found that nattokinase at a dose of 10,800 a day effectively managed the progression of atherosclerosis and hyperlipidemia with significant improvement in the lipid profile, or in cholesterol levels in lay terms. A significant reduction in the thickness of the carotid artery intima media and the size of the carotid plaque was observed. This is huge because the carotid arteries are what run up on either side of your neck into the brain to supply blood to the brain. And so as those thicken and become atherosclerotic and the lumen narrows, you're getting less blood to the head and higher risk of clotting. So this showed nattokinase lowered that size. The improvement rates range from 66.5% to 95% reduction in those carotid thickness markers and plaque size. That's amazing, and that's not a drug. Also, regular exercise further improved the effects. Co-administration of vitamin K2 and aspirin with nattokinase were synergistic. There were no noticeable adverse effects associated with use. So they conclude the dose of 10,800 fibrinolytic units a day of nattokinase is safe and well tolerated. We could stop there, but getting into the weeds is helpful. So awesome study on over 1,000 patients. So very important. Now, one thing I want you to understand, if you go wherever you go and purchase supplements right now, you will notice that any of the nattokinase supplements you look at, the dose in the dose, whether it's 1 capsule or 2 capsules, is 2,000 fibrinolytic units a day, or 2,000 FU per day. The dose found in the study that's effective to create these changes is, call it 11,000 FU per day. So it's 5.5 times what the dose on the bottle says. And you might say, holy cow, that's scary. Well, no, it's safe and well tolerated, and I'll show you the safety data before we're done today. So if you're already taking nattokinase and you're taking 2,000 a day thinking you're doing something good for yourself, the studies actually show that's not effective at achieving the goal of reducing atherosclerosis risk and reducing your cholesterol levels. We need at least 6,000 a day, and that's what previous studies are saying. Is other studies using high doses ranging from 6,000 to 7,000 FUs per day showed nattokinase was effective in lowering total cholesterol, triglycerides, and LDL in hyperlipidemic patients, and was also effective in reducing the thickness of the carotid artery and the size of the carotid plaque. So if you're like, hey, I don't want to swallow that many pills, well, there are some studies that say at as little as 6,000 fibrinolytic units a day, you can get these effects. But this study found that 10,800 daily was excellent and very effective, and we're going to see that. But before we get there, what was also neat about this study is they didn't just study nattokinase in isolation by itself. They also looked at other factors that may influence its effects. So, hey, are there lifestyle factors that could increase or decrease its effect, right? Yes, there are. So if we can take the ones that help augment its effect, we can get where we want to go faster potentially. Or maybe we could take a lower dose instead of 10,800 a day. Maybe we could take 6,000 a day and piggyback the synergistic lifestyle factors, and maybe get the same effect as someone that was taking 10,800 a day and not doing the lifestyle factors. So something to think about. What are those factors? Well, the authors say here, the effect of nattokinase can be influenced by factors such as gender, dosage, lifestyle, body mass index, smoking status, alcohol consumption, and co-administration of aspirin and or vitamin K2. The researchers found that those who exercised had better results with nattokinase than those who didn't exercise, or those who were active versus who weren't active. And the authors distinguish active as more than 5,000 steps per day. That was exercise, versus the sedentary group were the people who got less than 5,000 steps per day. Alcohol consumption matters. Consumption of over 100 grams of alcohol per week on average was the alcohol group. Those who drank less than 100 grams per week on average were the non-alcohol group. And that threshold was defined by a previous study here. So if you drink alcohol and you're getting more than 100 grams per week, and you decide to use nattokinase, that's working against the nattokinase. So perhaps stop the alcohol and take the nattokinase, because alcohol is negative for your cardiovascular health anyway. So that would be beneficial if you just stop that. Smoking, smokers, nattokinase had less of an impact on smokers than on non-smokers, which is pretty intuitive because smoking is terrible for your cardiovascular health. And then participants who took vitamin K2 at 180 micrograms per day in addition to nattokinase saw benefit, and so did those with baby aspirin, as we'll see. So taking a nattokinase by itself, 10,800 units per day for a year, what did it do to lipid profile or your cholesterol levels in lay terms? It created a significant reduction in triglycerides, total cholesterol, and LDL, which is, commonly phrased the bad cholesterol. It also increased HDL, which is commonly called the good cholesterol. I would argue there's not good and bad, there's only necessary, but that's a video for another day that we've already made. So I'll link to that here, and you can dive deeper in that if you'd like. Check this out. Nattokinase administration for 12 months led to a decrease of total cholesterol by 16%, of triglycerides by 15%, and of LDL by 18%. That's huge. And that's without a statin, right? That's just taking nattokinase. That's big because high cholesterol, especially the bad forms of LDL, which again, LDL isn't bad in and of itself. There's protective LDL and there's dangerous LDL. So we need to dig into that further, but lowering dangerous LDL lowers atherosclerosis risk and cardiovascular risk. Nattokinase suppresses atherosclerosis as measured by the carotid intima thickness and carotid artery plaque size. They were decreased significantly. Size of the plaque was decreased up to 36%, suggesting that nattokinase is very effective in improving and reducing carotid atherosclerosis. Again, that's huge because a clot in your carotid is cutting off blood to the brain. A plaque in the carotid that breaks off is traveling up into the brain and promoting a stroke somewhere. So reducing those, the size of the carotid thickness or the carotid plaque is potentially life-saving. 2/3 of carotid plaques, patients noticed up to 66% reduction in the plaque size and 77% showed reduction in the carotid intima thickness. Other factors contributing. All right, so another thing that makes this really important, you might say, hey, how do I know if I have carotid artery intima thickness? Well, you could go get a carotid ultrasound and they measure it via ultrasound and can tell you exactly where you're at, okay? And you might say, well, I'm 30 years old, I'm not at risk. Well, you might be, so age doesn't mean you're not at risk. But to that point, this study was 491 men, 571 women, average age of 67 and a half, okay? Ranging from 63 to 85 years old, but average age, call it 68. Why is that important? Well, because these people at that age probably have, progressed cardiovascular disease and carotid artery issues as compared to if this was a study on a bunch of 20 or 30-year-olds. So the fact that nattokinase is getting these changes in that age group is huge. And so what if we use it? What if we begin using it at a younger age or a healthier state? Potentially, big time returns for us from a health perspective. How did the other factors affect the nattokinase? Okay, one, we found that nattokinase at 3,600 units per day was not effective in lowering cholesterol or suppressing atherosclerosis. So again, less than 6,000 units has not been shown to be useful. So you're going to have to take more than the bottle says. What should you take? Speak to your doctor who knows you specifically and what's going on. But if we just went by the research is saying at least 6,000. This study is saying 10,800, and all studies show that it's safe. The lipid lowering and anti-atherosclerotic effects of nattokinase were better in participants who exercise more compared to those who exercise less. So again, how can we use lifestyle factors to synergistically augment the results of nattokinase? Well, here's one: exercise. And again, this study was just talking about steps, okay? So if you're at least getting your steps in, and number 5,000 was the cutoff, 10,000 is the usual recommendation, right? So what if you're getting your steps and then you go do weights and you do some high intensity interval training? That's likely going to make it even better. The effects of nattokinase on obese subjects were more prominent than in non-obese subjects. Well, that's, pretty intuitive, since on average, obese subjects have a higher cardiovascular risk and clot risk and those things. In smokers and alcohol drinkers, we found that the cholesterol conditions and atherosclerotic conditions were generally worse compared to non-smokers and people who drank less. Again, that's pretty intuitive, but another reminder that those two things, smoking and drinking, promote heart disease. And so even if you're never going to take nattokinase, but you're smoking and drinking, if you reduce those or eliminate those, you're already helping yourself. How about vitamin K2? Co-administration, so taking the nattokinase and the vitamin K2, showed a synergistic effect on blood lipids in the high cholesterol patients. There was no significant impact on other indicators of atherosclerosis. So the K2 combined with the nattokinase did not show increased impact on the carotid artery thickness or plaque size, any additional than what the nattokinase showed by itself. But lowering the cholesterol is beneficial in and of itself. So if K2 is going to help you do that better, that is definitely worthwhile. The use of aspirin and nattokinase had a synergistic effect and suppressed the atherosclerosis progression, meaning that favorable changes in the lipid profile and of the progression were more significant. So aspirin helped both the cholesterol and the carotid markers. So this is great. What about safety? Is it safe, and how do we know? Well, yes, it's safe. Again, here they say is one issue with the research is that they've never established an effective dose in terms of, there's studies use different doses, and so some studies will say, hey, nattokinase isn't useful, and some will say, yes, it is. Well, if you're just reading the title, you could be fooled. You have to dig into the study and say, well, what dose did they use? And what they found, again, is that the effective dose is somewhere between 6,000 and 12,000 units daily. If you're taking less than that, you're not going to get the changes you're hoping for. So we want to be taking at least 6 to 12. This study used 10-8, and there was no concerns of toxicity in this study. Nattokinase comes from natto, and so natto is commonly eaten in Asian countries. In Japan, it's been showed that there's no concern for toxicity when adults take 1,000 to 14,000 units a day, and no toxic side effects have been observed in rats using up to 1.43 million units a day. What would be 1.43 million units in humans? So there's essentially zero risk of toxicity or negative side effects here, based on all the research ever done. So in conclusion, the daily dose this study finds very effective for lowering your cholesterol parameters and your carotid artery thickness and plaque size is 10,800 units per day. And they did that for a year orally. So they were taking, capsules the way that we could take it. The 10,800 units is significantly effective in the management of atherosclerosis progression and hyperlipidemia. There are no adverse effects associated with its use. We also demonstrate that other factors, including lifestyle and co-use of vitamin K2 and aspirin, could contribute positively to the outcome. So they could make your outcomes even better. And again, those lifestyle effects are exercise, reduced smoking, reduced drinking, and reduced body weight, of course. So this is very, very powerful and very important, given that cardiovascular disease is the #1 killer in the United States, and given the recent uptick in cardiovascular events. Now let's jump over to the whiteboard to talk about the fibrinolytics a little further. All right, so if we keep the discussion going on these proteolytic enzymes called fibrinolytics, and what they do is they break down fibrin, they lyse it, that's what lytic, they lyse the fibrin, so they break down that early step in clot formation. And we just spoke about nattokinase at length, looking at that recent study, and it said that 10,800 fibrinolytic units per day decreased cholesterol, atherosclerosis based on carotid artery thickness and plaque size. What other fibrinolytics are available to us? There's also lumbrokinase, and there is serapeptase, which is also called serapeptidase. There's a couple names for it, but it's the same. They mean the same thing. Both lumbrokinase and serapeptidase come from worms. Worms produce it, and it helps them. It helps them break down the cocoon so it can, break out of its cocoon. So these two are worm derived. The nattokinase comes from natto. Now, lumbrokinase and serapeptase, because they're from worms, tend to be pricier, because you could imagine they're harder to process and accumulate than natto is. But it might be worth the money for someone who's acutely worried, because lumbrokinase is 300 times more powerful than serapeptase, and it's 30 times more powerful than nattokinase. So if you're looking to get maybe the effects that the nattokinase got, but faster, maybe you could take the 30 times more potent lumbrokinase and try and get there. Now, how much of that should you take? Not sure, because we don't have studies on the lumbrokinase, but if it's 30 times more potent than the nattokinase, you may need obviously a third of the nattokinase dose. So maybe 3,000 of the lumbrokinase, or maybe 300, who knows? The studies haven't been done that I'm aware of, but these are options that are available for you. Nattokinase is easy to find and definitely the least expensive of these three. The only problem is that I'm aware of, no one's made a capsule that's this dose yet. They all tend to be at the 2,000 dose, so you'll have to take 5 to 6 of those a day to get that dose. But if it lowers your cholesterol naturally, lowers your carotid thickness and plaque size naturally, and saves your life, no problem. So let's open this up for questions.
So I have a question.
Mm-hmm.
So is nattokinase and the other ones just for someone who has high cholesterol, or is it somebody with like an active blood clot, or like who would be using this?
Any of those people. But it'd be better to use before the blood clot. There's actually been studies. So, and if you have a clot in the hospital, okay, they'll use a drug called TPA to bust that clot. This is the clot busting drug. There's been some research that showed that nattokinase the equivalent dose of nattokinase that would equal the TPA had equivalent results in the clot busting. So, you know, that suggests that this would be effective in the acute scenario, but why wait to have a clot to use it, right? The goal would be to never have the clot. And so, you know, prevention is an ounce of prevention is worth a pound of cure, right?
Now, would this also be appropriate for somebody with a clotting issue, like without high cholesterol, let's say an anti-cardiolipin antibody syndrome, something like that?
Potentially. I haven't seen studies on that. So I don't want to, you know, give a definitive answer there.
Okay.
And then just to piggyback on that question, for those people whose blood is too thin, this wouldn't be a strategy, right? If you have trouble clotting, you don't want to be taking this. So for like bleeders and people like that, hemophiliacs, that sort of thing.
And you probably want to consult your doctor if you're taking a blood thinner already, correct?
Yeah, for sure.
Thank you.
And you're welcome. And maybe bring these, you know, this study and some of the other papers referenced in this study to show them, you know, what's my risk? You know, is it worth seeing if nattokinase could give me equivalent results to the warfarin or Coumadin without the side effects, potential side effects?